One, and welcome to the update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue.
Welcome, everybody. Welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Dominic Cardy, Minister of Education and Early Childhood Development.
Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Dr. Russell.
Bon après-midi à toutes et à tous.
Good afternoon.
The third wave of the COVID-19 pandemic has been battering much of North America for the past 2 months, and in the last week, its strongest currents have struck our nearest neighbor. The explosion of cases in Nova Scotia, particularly in the Halifax area, is deeply concerning to everyone in New Brunswick, and I'm sure that you will join me in offering our support to our Nova Scotia friends, family, and loved ones. In barely a week, Nova Scotia has seen over 1,000 new COVID-19 infections. That's more than New Brunswick has experienced in the last 4 months. And there has been an upsurge in hospital admissions in Nova Scotia affecting the young and old alike. This demonstrates yet again the power of this virus in its newer and more contagious form. It underlines yet again that this can happen anywhere, including here. It shows us yet again why we all must stay vigilant and follow public health guidance and advice.
Repercussions of the pandemic in the province was not as serious up till now. However, we have also suffered a hard upsurge since the third wave. Since our last account, COVID-19 has cost 2 lives in the province. That is the 37th and 38th death registered in New Brunswick since the beginning of the pandemic. But we're not only talking about numbers here. These people had families and close people to them taking care of them, and are now in really serious. I offer my sincere condolences to the families of these New Brunswick residents. I'm convinced that the entire population of New Brunswick shares your problems today. The sector in Zone 4, that is the City of Edmundston and region Upper Madawaska, St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls still remain in the orange phase. A reassessment of the color phase for that sector in Zone 4 is going to be held next week.
Best hope in preventing severe illness, hospitalization, and death due to COVID-19 is to get vaccines into the arms of as many New Brunswickers as possible, as quickly as possible. And today, we will reach 250,000 New Brunswickers who have received at least 1 dose of a COVID-19 vaccine. This is a tremendous achievement, but we must and can do more. And now, we are going to accelerate our efforts even further. Dès aujourd'hui,
As soon as today, all people of 50 years of age and more in the province are going to right to receive a vaccination. And you make appointments with your pharmacy or a clinic offered by the regional health authorities.
Today, all New Brunswickers 50 years of age and older will be eligible to receive a vaccine. You can make your appointment with your local pharmacist or through a clinic offered by our regional health authorities, and I am told there are lots of spots, so please call as soon as you can. We are also making the vaccine available to young people who may be more vulnerable to its effects. Anyone over the age of 16 with at least 2 chronic conditions can now receive a vaccine. More details on eligibility are available on the government's website. If you are now eligible, I urge you to make an appointment today and don't wait. By taking the vaccine, you will be helping to save lives, prevent illness, and protect our healthcare system.
Today, Public Health confirms that there are 4 new cases of COVID-19 in New Brunswick. All declared cases today are directly tied to travel, and all are in isolation. There is 1 new case in Zone 1, that is the Moncton region in southeast New Brunswick. In Zone 2, including St. John's Kings and Charlotte, there's 1 new case. In Zone 3, that is the Fredericton region and Upper River Valley, St. John, there's one new case. There's also one new case in Zone 6, that is the Bathurst and Acadian Peninsula region.
Public Health has confirmed 4 new cases of COVID-19 in New Brunswick. All of the cases reported today are directly related to travel and are self-isolating. In Zone 1, which is Moncton and southeastern New Brunswick, there is 1 new case. In Zone 2, which is St. John, Charlotte, and Kings counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case. In Zone 6, which is Bathurst and the Acadian Peninsula, there is also 1 new case. There are now 141 active cases of COVID-19 in New Brunswick. 6 individuals are currently in hospital, including 2 who are in intensive care unit. There are also more than 850 people across New Brunswick now in self-isolation, helping to prevent the further spread of this virus. Please provide any support you can to those who are helping with this effort. And I want to thank everyone at the University of New Brunswick for their cooperation in helping to limit the spread of COVID-19 in their community. Faculty, staff, and students are now permitted to access the campus in accordance with the university's approved operational plan. Public Health is continuing to monitor 2 residents to ensure this outbreak is contained. Residents and staff of McGee House were tested this past Sunday. Another round of testing for residents and staff is slated for tomorrow. To date, there have been 13 confirmed cases in this outbreak. For those who have tested negative so far, we expect their isolation period will end on Saturday, May the 8th. Residents and staff of Elizabeth Parr Johnston residence were retested on Monday and are awaiting further results. To date, all results from this residence have been negative. If no new cases emerge from these latest tests, the isolation order would be lifted sometime tomorrow.
I'm really happy of the enthusiasm demonstrated by New Brunswickers faced with our vaccination campaign. Every day, we can see on the social networks of people who are happy to say that they've just been vaccinated. If you've received your first dose and you're wondering when you're going to receive your second one, I ask you to continue to be patient. What we desire is that at least all adults in the province received at least 1 dose, which should be done before the end of June. And there's going to be a public announcement in clinics for administration of the second dose when they will start. And I can reassure that nobody's going to wait for more than 16 weeks between doses.
My hope is that everyone will seek a vaccine when they become eligible, and I urge you to take whatever vaccine is offered. The more people we protect with a vaccine, the better positioned we will be to prevent serious illness, hospitalization, and death from COVID-19. This 3rd wave continues to challenge us. It comes at a time when COVID fatigue is running high and patience with public health measures is running thin. And I do understand the frustration and impatience that so many people are experiencing right now. And really and truly, the variants mean that we need to stay vigilant and we need to continue to vaccinate while we really reach that level of population protection that we're looking for. So I urge you to remain hopeful, and it is hope that's going to get us through this. We must all look deep within ourselves and find that hope that we need. And remember, it is a powerful force. And today being the 4th of May, may the 4th be with you. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue.
Good afternoon, welcome everyone.
So today's a great day for Gen Xers as we get to start getting access to vaccines for a new generation of New Brunswickers, and the measures that Dr. Russell have announced, opening up shots for younger folks and for people of all ages above 16 who've got 2 chronic conditions or more. This is fantastic news. So in addition to that good news, really pleased to share that yesterday, with the exception of a very few close contacts, the vast majority of students and staff at George Street Middle School in Zone 3 returned to in-person learning. The situation has been very stressful for the students, for the staff, and for their families, and for the broader Fredericton community, especially because that school community has been self-isolating now for a complete week. So I want to thank everyone for their patience and their understanding. Thank everyone who stepped up, took part in the testing programs, and a special shout out to the staff teachers especially, and all the folks who work as EAs and support staff in our middle schools. We've had lots of discussions around elementary schools and the bubbles, and high schools and blended learning, and the middle schools have had the fewest adjustments, and that's put the biggest load, I think, on some of the teachers. And they deserve huge credit for having got through a difficult year with the sort of calm and competence and professionalism and caring that we expect from them. So by coming together and following public health guidelines, their cooperation helped to make sure that school environment and the larger community stayed safe and healthy. So jeudi.
So Thursday, another case was announced at École Notre-Dame in Zone 1, and the school community was informed. It's a pleasure to point out that through exceptional cooperation that we've observed all during the school year with public health, the majority of the students could return to school Friday, while a small group of students continue to learn from home. Over the past few months, we have acquired a lot of experience in managing cases in the schools. I'm convinced that with your cooperation and through your self-help and your goodwill, we are able to take up these challenges quickly and in a safe way. I'd like to remind to everyone that each situation where a case is confirmed in a school is a bit different, and our answers equally are going to be different as well. But we are going to continue to work with our partners to minimize the impact on learning while protecting the health and safety of our students as well as our staff.
Families about any potential COVID exposures or positive cases in a school, anything that impacts a childcare facility, and the families and the school community will be notified directly. So as usual, no news is good news. Please keep on following those public health measures, both in and out of school settings, because the end of the school year is in sight, and we have to get our communities together to support keeping our schools healthy, safe, and open. Les précautions.
The precautions and sanitary measures that we're taking protects us ourselves as well as protecting others.
We look forward to releasing our guidelines for graduation ceremonies to help schools plan their activities to commemorate graduates and their outstanding accomplishments, and talked a little bit about proms last week. And while school-organized proms aren't going to be happening this year, I know that schools and school districts are doing their best to organize events, and lots of parents stepping up as well to properly celebrate this important milestone in the lives of our grads. And the important message there again is if you're organizing an event, reach out to public health. They'll tell you how you can do it safely while following the rules. This is what we don't want to see is parties happening behind closed doors, underground, exposing New Brunswickers and their families to risk. So talk to public health. They're there to help.
It was brought to our attention that families and community groups have planned their own celebrations and events, and we're insisting that all those who are planning such activities to make sure that they're cooperating with public health and public safety, and as well that they respect all the directives, meaning to protect the health and safety of the participants.
On non-school related news. So in recent days, 2 residents of the Pavillon Beaulieu special care home in Grand Falls have passed away as a result of COVID-19. On behalf of the government, I want to express my condolences to the 2 families who are grieving the loss of their loved ones. As we have throughout the pandemic, we have to take every measure possible to protect the most vulnerable in our society. And right now, that means one thing: get vaccinated, and get vaccinated as soon as you're allowed. It's crucial that our long-term care workers, who are part of the first group eligible for the vaccine, recognizing both their sacrifice, their service, and their critical role in protecting our most vulnerable citizens, get vaccinated. I want to call on any long-term care workers who have not yet received their vaccine to consider the lives of the people you care for each and every day. Not abstract Facebook pages filled with conspiracies and foolishness, but real life people, people who care for you because they can't care for themselves. This vaccine, these vaccines that are now available to New Brunswickers represent a miracle of modern science that a year and a half ago, people sitting around tables like New Brunswick's cabinet, talking to folks like Dr. Russell, we had estimates of 3, 4, 5 years before a single vaccine was developed. And now we have a portfolio of vaccines available to New Brunswickers for free today that will put an end to this misery of the last year and a bit now as we've endured isolation, lockdowns, economic damage, devastation to families, unnecessary deaths. We can stop this. We can stop this with the vaccines that our society has produced for us to use. So please take advantage. Book an appointment today if you haven't done so. Because of course, everyone cares about the most vulnerable. But for those folks working in those special care homes, this is the best thing you can do to protect those people who depend on you every day. Because as Dr. Russell announced, beyond special care home workers, beyond the targeted groups that have been singled out for special treatment because we needed to get them vaccinated first, now, today, every New Brunswicker 50 years and older can get access to a vaccine. As I said, finally, Gen X, our moment has come. Get out there, let's show what we can do as the baby bus generation and get our vaccines as quickly as we can. People who are 16 years and older with 2 chronic conditions are now eligible to get vaccinated. This is an important change as well. I've talked to some people who had 2 conditions, were concerned they weren't able to get a shot as of up until today. Share the news with your friends, your family, the people you talk to. People might not have seen this briefing. They might not read the news. Make sure they get this good news, that vaccines are now available. We're continuing to do everything that we can in the school system, of course, to provide a safe learning environment. And this wider availability for vaccines is a big part of that. But we have to continue with the rise of variants of concern around the world, here in the Maritimes, to be vigilant and to do what we can to protect those who are at risk from COVID-19. This
is the reason why we recently put in place solid measures to protect our borders. We are determined to ensure that people who come back after having traveled for non-essential reasons or for leisure, as well as people who move to New Brunswick and business travelers be put in quarantine in all safety. Any person that comes in the province must have a self-isolation period of 14 days, exception of rotational workers, truckers, and travelers who go through the borders daily, and different requirements in isolation matters.
5 hotels across the province where returning travelers can complete at least 7 days of their 14-day isolation while awaiting the result of their first COVID-19 test, which must be taken on day 5. But in some individual circumstances, we know that returning travelers may require an alternative to a specific hotel as a designated facility, such as a standalone residence.
The decision to know if change managements are necessary are going to take it on a case-by-case basis. We're going to continue to see that all site utilized for a self-isolation period answers the requirements to protect the New Brunswickers. Any person going in an isolation place is going to be submitted to controls, reinforced controls during the quarantine period.
Found to be non-compliant will be directed to a designated isolation hotel at their own expense and will face fines. I want to take this moment just to recognize the huge efforts taken by the facilities who have volunteered to partner with the Red Cross to deliver this program to help keep the residents of this province safe. You can imagine you're running a for-profit business in a hotel, and you're now identified as being a COVID hotel. Not necessarily what you're doing if you're a bottom line. But I want to take this moment to recognize those hotels, the people who work in them. They've had to increase their staff numbers significantly, in some cases calling back employees who were on leave. They brought in teams to answer phones. They've had to order personal protective equipment, prepped and cleaned rooms, brought in huge amounts of additional food for meal plans, and, of course, most importantly, developed detailed operational plans to keep other guests and their staff separate and safe. So rather than looking at those hotels and wondering why anyone would sign up for such a thing, please, when you've got friends coming to New Brunswick, when we open, when we complete our voyage through this pandemic, suggest those hotels is a good place to start. They stood up for New Brunswick when New Brunswick needed them. Their employees, their managers, the owners have gone to tremendous lengths to ensure people can isolate away from others, and we owe them that debt of gratitude. So I know, as Dr. Russell said, everyone is tired. but we have got to keep taking care of one another. Please continue to wear your mask, continue to wash your hands, keep your distance, and if you're sick, stay at home and get tested. And as soon as you're able to, take advantage of the incredible opportunity that we're being offered and take your shot. We have spent the last year and a half talking about how we get to the end of this pandemic, and now we're nearly there. And for the enormous majority, the nearly 100% of New Brunswickers who have stood up consistently, whether standing up meant staying home, whether standing up meant curtailing visits to other parts of the country or around the world to visit loved ones in moment of need, whether it was celebrations of births or marriages, or sad moments of saying goodbye to a loved one. New Brunswickers gave up those opportunities. Our grads gave up their ceremonies. Everyone has sacrificed. And when I get emails and I see pictures of people claiming that somehow their fundamental rights as Canadians are being violated right now because they can't attend an anti-mask or anti-vaccine protest, then at some point, I have to ask whether or not in the education system we're doing enough work on our history curriculum. We have a civilization, a country, and a province that puts enormous weight in individual life. And that's as it should be. And we're going to continue to do the right thing because the enormous majority of New Brunswickers want that. And they want to see an end to this pandemic. They want to get rid of their masks. They want to be able to embrace their loved ones again without fear. And we are going to continue to take every measure necessary to make sure that over the course now of the next weeks, not months, that vaccines are offered to every New Brunswicker, that our rates of immunization go up, so that our rates of infection go down, and we push back against the variants and against COVID-19 and put an end to this stage of this pandemic. But we need your help. So for those who question public safety guidelines, who question public health decisions, who undermine faith in our vaccine system, all I can say is please look at the evidence. That we have folks at different levels, as Dr. Russell said, in some cases undermining our decisions about which vaccine to take. If a vaccine is approved by Public Health Canada and approved by Dr. Russell and her team, take that shot. Ignore NACI, ignore anti-maskers, ignore the people undermining faith and science, and do your part for New Brunswick. N'oublie pas.
Do not forget that by following these steps and measures, you can protect not only yourselves, but also all your friends, your family, your neighbors, and your colleagues. Summer is coming soon, and we all need to have fun, so let's work together right now and make it sure that it is a formidable summer.
Thank you very much. Merci.
Thank you, Minister. Thank you, Doctor. Merci beaucoup, Monsieur Ministre.
Thank you, Mr. Curdy and Dr. Russell.
Questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder au...
We'll now proceed to questions from the press. You have the right to ask a question in the official language of your choice. Each reporter is going to have one question and a quick follow-up. Make sure to mute your mics. Laura Brown, CTV.
Hi, Dr. Hi, Dr. Russell. I'm wondering, there is still some concern about the vaccines dose, the time between dosages. So is there any consideration of decreasing the amount of time between the first dose and second dose, specifically for seniors?
Merci pour votre patience. Please stand.
Thank you for your patience.
you want me to?
Laura, can you please repeat your question?
Yes.
Ah,
Sorry.
now we can hear you.
Thank you.
Dr. Russell, I'm wondering if there's been any consideration of decreasing the amount of time between the first and second dose of vaccines, specifically for seniors. We are seeing that at least, I mean, in the case of Pavillon Beaulieu, one of the individuals got their first dose but didn't get their second dose, and then, as we know, has passed away.
Well, I don't have specifics that I can share around individuals' vaccine status, number one. But in a general sense, we're not planning to change our rollout. I know that for long-term care facilities, nursing homes, and adult residential facilities, the plan was to make sure that many of them had their second doses. But again, regardless of whether they have one or two doses, the immunity doesn't actually increase against COVID-19 until it's been in your system for at least 2 to 3 weeks. But as of right now, we are doing second doses right now in long-term care facilities.
Ms. Brown, do you have a follow-up?
I'm just wondering if you can update us on the situation at Pavillon, if there's still 35 residents, 14 staff that have contracted the virus. I know that there were swabs happening yesterday.
Yes, those are the current numbers, and we are dealing with the South African variant in that particular outbreak. So we do have Red Cross that is assisting with that particular situation, and it is ongoing, and yes, we will continue to do swabbing.
Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. You mentioned public health is looking into the ventilation systems of isolation hotels. What are you finding out? What are the findings to date on that?
The ventilation systems that I have been involved with respect to investigation was the one at McGee House. So the knowledge that I have about that particular ventilation system in terms of the investigation, that's all been looked after. And our conclusion after all of the information that we had been provided with really points to fomites in that situation, so surfaces that people came into contact with.
Ms. Ibrahim, do you have a follow-up?
Yes, and just to confirm, so you are not looking into ventilation systems of isolation hotels?
I don't have any knowledge about that. Was that a question that you had posed to the Department of Health, or?
I was just under that impression, so we can move on with the second question. There's been some criticism lately about the number of special care and nursing home workers who are not vaccinated. The association says convenience is one of the main obstacles. So why can't these workers get vaccinated at their local pharmacy rather than having to drive to a clinic offered by their health authority?
Well, with respect to vaccination, you're talking about healthcare workers who work in adult residential facilities, long-term care facilities, and nursing homes?
Yes, that's right.
I'm not aware that there are any constraints that they have to do one or the other. I'm assuming that they are eligible to go to whichever is more convenient.
Okay, so they can go to pharmacies.
I wasn't aware that that wasn't an option.
Okay, thank you.
Tom Bateman.
Hi there, can you hear me? Perfectly. Great. I'm looking for clarity on what exactly would qualify for an exemption for a non-essential or leisure traveler. Dr. Russell, can you explain how that is evaluated? And how many have been granted, actually?
Are you talking about the pre-existing exceptions that we are continuing to allow that have been allowed throughout the pandemic, or you mean the case-by-case situation that Department of Public Safety is in charge of right now?
Yeah, the latter, with respect to the isolation hotels.
Yeah, so that is on a case-by-case basis, and I believe that they would be looking at criteria in terms of safety with respect to nobody else being in the domicile, that those types of things, but it is on a case-by-case situation.
And do you know how many there have been?
That I don't know.
Jacques Poitras, CBC.
Oh,
You got two in there, Tom. Jacques?
Am I cut off? Oh, sounds like I am. Okay.
Sorry, Tom. Dr. Russell, back on April 23rd, the health staff sent out a graph showing projected vaccination rates by week through to the end of June. It was a bar graph. And the week of May 24th to 30th was highlighted in red, showing 60% vaccinated. What's the significance of that week that's highlighted? Is it a target or a threshold for something to happen?
I don't have that particular document in front of me, Jacques, but what I do know right now is that the increased number of doses and the steady delivery of those doses throughout the next 4 weeks is quite substantive. So we're really on track right now to get through each week in the vicinity of 43 to 45,000 doses. So each week we'll be able to continue down the path of announcing different age groups that are eligible to receive vaccines. So in terms of a threshold, again, I don't have that document in front of me, but certainly if we continue in those 10-year cohorts, then we will definitely be in a really good position by the end of May. But again, our goal is to get as many people vaccinated with their first dose, and then ideally with their second dose, hopefully by late summer. But if everything goes well and we get more doses than expected, then we just increase our timeline, and that's a good thing.
Mr. Poitras, follow-up, please.
Yes, on Johnson & Johnson, acknowledging the delay with the quality control issues, any further progress on deciding how to take advantage of a one-dose vaccine, like what group you might aim that for, and is that delay at all affecting the rollout plan?
It's not factoring into our rollout plan. We definitely have a vaccine task force that's involved in those discussions around how to use all different vaccines that are available to us. But right now, we're just in a holding pattern.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, can you please give us an update on the Bayside plant where 2 employees tested positive for COVID-19 on Friday? Have any other employees or close contacts tested positive since? Is it the variant, and how many people are self-isolating?
Hi, Vicky. Well, I was on call on the weekend, so I was involved in the situation for the most part over the course of the weekend. But since then, again, my knowledge of that situation was that there had been 2 people that tested positive. And in terms of the strain, it definitely was not a strain in terms of a variant of concern, in terms of aggressiveness and transmission and aggressiveness and symptoms. But we are continuing to test people in the St. Stephen area because the way that these cases popped up, they hadn't. Again, we just want to make sure that we're not missing cases in that community, so we're increasing the testing capacity in St. Stephen right now.
Ms. Hogarth, do you have a follow-up?
Just a quick follow-up. Is there any idea yet of the source of those 2 cases?
How they got to that facility?
Yes.
Well, no, we don't actually know.
Thank you. Jean-Philippe Hughes, Radio-Canada.
M'entendez-vous?
Can you hear me? Yes. Go for it. Mr. Hughes? Can you open up your mic? Unmute your mic? Sorry for that. The question is for Dr. Russell, and the question was asked. I'd like a clarification according to criteria for the exemptions for isolation in the hotel. We're talking about a one-family home separately. So basically, are these the same criteria that applied already before you had the hotel isolation? I believe so. But I believe that that information is on our website as well. These are the exemptions that we make on a case-by-case situation, but it's really based on a safe situation. Mr. Hughes, follow-up? Yes, I have a follow-up for Mr. Cardy. I'd like to explain why the government took a step back on a Saturday on hotel isolation. What was not working? I know it's a question, like always, with COVID. There's always a need to put the plans in place based on the situations that are evolving. And we're making decisions based on each case-by-case basis. And if somebody doesn't have a plan for self-isolation that is approved by public health, so that is why we have the hotels that are there. We just wanted to clarify that. So it's not really a change, it's been a clarification more than anything else. Mr. Hughes? Thank you.
Brunswick News.
Thanks, Bruce. To Minister Cardy, earlier you lumped NACI into the same sentence as anti-maskers. I just wanted you to reiterate if that's a smart thing to do, and can you elaborate on your thinking there?
Very glad to. There's some interesting headlines around the world the last number of months as different governments have, in some cases, and I'd say nearly all cases, accidentally undermined confidence in science and medicine. And I have not seen anything based on all of the scientists and doctors I've spoken with that support some of the concerns that have been raised by NACI recently. And I think they have, I would refer to the Prime Minister's comments today, where he said people should get the first shot they are offered. And given that NACI did not say that, I side with the Prime Minister, I side with the Premier, I side with Dr. Russell. And clarity around communications on science is incredibly important. And the difficulty we've had over the last year and a half is that too often governments have contributed to confusing the issue. And I'm really proud that the government here in New Brunswick, and one of the reasons we have one of the best rates of success against this pandemic is because we've used evidence and science to make our decisions. It hasn't been perfect, but the deviations from that central principle have been small and occasional. And in other places, they've been large and dangerous. And anyone who starts to undermine the credibility of the vaccine regime should be held accountable for that.
Mr. Harris, follow-up?
Yes, please. For Dr. Russell, I'd like your comments on NACI's words yesterday and if they should be held accountable for them.
Should NACI be held accountable for their words?
Just picking up on what Dominic Cardy said, that further to that, your comments on NACI's words and whether they muddle the water of your message.
Well, I think what I can say is that transparency and public confidence are very important. Providing people with up-to-date information is very important, and certainly here in New Brunswick, with our amazing communications team, we've been able to really navigate through a lot of the technical information, do great knowledge translation, and continue to provide the public with the information they need to know to take the steps they need to protect themselves against the risks of COVID-19. And I'll just leave it at that.
Thank you. Sarah Seeley, Brunswick News.
Oh, before we go on, though, I do need to correct the information that I gave earlier around healthcare workers in long-term care facilities and nursing homes, et cetera, being able to get their vaccine at a pharmacy. I did just receive information from my staff that that is not currently the process, but we are going to look at modifying that for the future.
Sarah Seeley, Brunswick News. Kathleen Jones, allbrunswick.com.
Hi there, Dr. Russell. In Nova Scotia, they're saying that opening vaccines to people in categories with underlying conditions rather than doing it by age might slow down the rollout. And I'm wondering if this is a concern for you in New Brunswick.
Well, I guess it depends on what you mean by slow down. And I think you have to remember that the context that people are looking at different rollout plans with respect to their case numbers. So right now in New Brunswick, our case numbers are low. Our rollout is working very well. And if there were a change in timing for anything, would it change by a week or 2 weeks? I think we're in a good position right now to continue with the rollout as we've laid it out. And as I mentioned earlier, if we get more doses sooner, then that'll just accelerate things. But our plan really is to be able to have everybody vaccinated with 1 dose between now and the end of June, and have everybody vaccinated with their 2nd dose between now and the beginning of September.
Do you have a follow-up, Ms. Jones?
Yes. And so is this, in your opinion, the quickest way to accomplish that goal?
Well, as I mentioned, it's all about context, and right now we are in a very good position, 1, with our case numbers, and 2, with the number of doses that we're expected to receive.
Thank you. Bobby Jean McKinnon, CBC.
Can you hear me?
Perfectly.
Great, thank you. Dr. Russell, you said before that public health recommended some minor changes to the ventilation system at UNB's McGee House residence. What were those changes, and have they been completed?
Yes, that is correct. So I was working with one of our public health inspectors who was working with the engineering folks at UNB around that ventilation system, and all of the information that they were able to provide showed that there was a teeny tiny chance that there could have been some cross-contamination with one particular component. So that was shut off last Tuesday, and they won't be turning it back on until we give the go-ahead.
Ms. McKinnon, a follow-up?
Yes. Hello?
Is now exiting.
Hold on. Go ahead, Ms. McKinnon.
Okay, thank you. Again, for Dr. Russell, you mentioned that public health is now trying to determine whether surface contacts in the McGee House elevator could be the potential source of transmission. We've heard a lot from experts lately about surface transmission being extremely rare. Can you explain what's different now with this case?
Well, we are dealing with the India variant, so with each new variant, we do learn different things, and so we don't make assumptions about what we know or don't know. So we try to be objective about that information, and certainly everything that we have amassed in terms of information about this particular outbreak points to that. So that's what our leaning is in terms of our hypothesis and conclusion.
Thank you, Ms. McKinnon. Simon Delattre, l'Acadie Nouvelle.
Yes. The number of deliveries, no. Sound is not very good. Is New Brunswick ready? Sound is awful. Cannot translate. We couldn't hear the question. Simon, can you repeat the question? Number of vaccine deliveries going to double from this week on. Is New Brunswick ready to follow that rate of delivery? Yes, absolutely. Simon? Do you have a follow-up? Yes. From what percentage of the population vaccinated can we hope to lift some restrictions? It's a difficult question to answer at this time, because as soon as we receive other information with other places and other countries that are a bit more advanced in their vaccination program, it truly is something that is going to be decided as we receive other information, that we see what percentage of the population is protected and what the protection is. Our goal, finally, is always to decrease the risk for the population from being hospitalized and needing intensive care. And with the vaccination, we make sure that it is going to be the case, but when that's going to be a level of protection against these risks that we're comfortable to change public health measures, it's still to be seen. Thank you.
ETV. Erica Butler, CHMA.
Oh, hi there, everybody. This is a question for Dr. Russell. Dr. Russell, as you know, there are hundreds of people in the detention market who are in perpetual self-isolation because they work across the provincial border in Amherst. A lot of frustration from people. They're wondering why they are being asked to remain in isolation when there are currently no active cases of COVID-19 in Amherst or all of Berlin County. Can you help explain to these folks what is the evidence of the risk that you see posed by people going to work in Amherst?
Great question. First of all, I just want to say that what Nova Scotia is experiencing right now is really, really challenging. And that is something that, again, our colleagues across the country and other provinces are having to deal with. And it's not something that we take lightly in terms of risks. So we know that right now the hotspot is Halifax. However, as you know, the incubation period is 14 days, and we don't know who's traveling where and when throughout the province. And so the risks are everywhere all the time without knowing, again, we don't have a crystal ball and knowing who's incubating in those different areas outside of Halifax. So we have to be taking a very cautious approach because we don't want to fall into the same situation that Nova Scotia is dealing with right now. I think they have over 40 people in the hospital right now with COVID-19. At our highest number of hospitalizations, I think we had about 20 plus, which really stretched our healthcare system, as you know. So we are in a very precarious position with respect to our proximity to Nova Scotia at the moment, and so it is very important that we put whatever measures in place are going to protect the population at this time, even though it does put a lot of stress and strain and hardship on people at this time. It is necessary.
People point to the situation in this particular Hamilton, where the province has acknowledged the nature of two communities, and people who commute between them don't have to isolate perpetually. I guess I'm wondering, why wouldn't the border community around Amherst and Sackville be treated similarly as that border community is?
You're cutting in and out, so I'm not really sure if it's the reception or where you are related to the microphone, but I could only hear half of what you were saying.
Can you repeat?
I can repeat it. Can you hear me okay now?
Yes.
So people here point to the situation in Hamilton, where the province has acknowledged the nature of the two communities and the communities don't have to be in perpetual isolation. So I'm wondering, why wouldn't the border community around Amherst and Sackville be treated similarly with that border community?
I'm really sorry, but I can't hear what you're saying.
Erica.
Do you want me to repeat the question as I heard it? I think I could make it out.
Okay.
Great.
I think it's cell coverage, but keep going. Thank you, Jacques. Jacques?
I think the question was why, if there's crossing allowed in Campbellton, recognizing the links between the two communities there, that doesn't apply in Amherst and Sackville.
For right now, the information that we have on the outbreak situation in Nova Scotia is such that we just are not taking any chances.
Thank you. Silas Brown, Global TV.
Thanks. Hi, Dr. Russell. Looking at the where things are at with the vaccine rollout, we're just a week from when people 60 plus were eligible, and now we're at 50 plus. Do you expect this, which covers really the largest cohort of New Brunswickers, to take more time, or with the massive influx of vaccines that we're seeing over the next little bit, can we expect more and more age categories where there are less amount of New Brunswickers to continue opening up in these next couple of weeks, maybe next week, 2 weeks, etc.?
Well, Silas, I think the good news is my understanding is based on the amount of doses we're planning to receive, I think we're going to be able to get through a very large amount of our population in the next 4 weeks because of that. So I think each week we're going to be able to continue to announce another age cohort. But you are correct, that is our largest cohort, so people do need to be patient while they're booking their appointments.
Thank you. Mr. Brown, do you have a follow-up?
Yeah, just quickly, I guess for all of us younger folks out there who are anxiously awaiting our shot, when can we expect to really see the doors thrown open and to have, everybody over the age of 16 become eligible for a shot?
Well, again, I feel like over the course of the next 4 weeks, we're just going to be able to continue to go down by age cohort of 10 years. And again, fingers crossed, if everything goes well, by the end of May, early June, we should definitely see that population be able to be vaccinated.
Thank you, Mr. Brown. I apologize to Tom Bateman. I did cut him off and I was somewhat rude. So, Mr. Bateman, if you'd like to ask your follow-up question.
Oh, thanks, Bruce. I'll be brief. Dr. Russell, has anyone involved in the hotel isolation program tested positive for COVID-19? And what happens to someone in that instance?
Yes, they have tested positive, and in that situation, they have to continue their complete 14-day self-isolation after that in the hotel.
Thank you.
Thanks.
That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour.
That's the end of our update for today. Thank you very much, everyone.